Welcome to Emergency Management, PATI Class 12. Let's learn how to stay safe and prepared.
Effective emergency management in sports and physical education. Emergency response is critical for safety during sports and physical education activities. It involves assessing injuries or illnesses promptly and accurately on the playfield. Planning a clear course of action ensures proper handling of emergencies in sports. Implementing the response plan quickly can prevent further harm and save lives. Reviewing the response helps improve future emergency management strategies. Recognizing the importance of emergency response prepares you for unexpected situations. Identify common emergencies in sports such as sprains, fractures, and heat stroke. Quick decision-making and calmness are essential during any emergency on the playfield. Training in emergency response enhances confidence and safety for all participants. Unit
How to create an effective emergency action plan for any situation. An emergency action plan ensures quick and organized responses during emergencies. Include essential contact information like emergency numbers, hospitals, and guardians. Keep first aid resources ready, including stocked kits and CPR-trained personnel. Plan clear emergency routes to medical facilities for swift evacuation. Assign specific roles and responsibilities to prevent confusion during crises. Conduct regular drills to keep everyone prepared and confident in emergency actions. Customize your plan by assessing risks based on location and activities involved. Engage teachers, staff, and students in training to build a safety-conscious community. Update the emergency action plan frequently and practice it to ensure effectiveness.
Effective steps in the emergency response process everyone should know. Start by evaluating the severity of the injury or illness immediately. Determine if professional medical help is necessary based on the condition. Follow the emergency action plan carefully, provide first aid and call for help. Evacuate the area if the situation demands to ensure safety for all involved. Keep calm and communicate clearly with emergency responders when they arrive. Use available resources wisely to support the injured until professionals take over. Monitor the injured person's condition continuously during the emergency response. Review the response afterwards to identify what worked and what can improve. Update and practice your emergency plan regularly to stay prepared for any situation.
Examples of emergency situations and how to respond effectively. 1. Heat stroke shows high fever, confusion, dry hot skin, and fainting signs to watch for. For heat stroke, use cool water immersion, ice packs, fan misting, and seek medical help immediately. 2. Allergic reactions or anaphylaxis cause breathing difficulties, swelling, and possible collapse symptoms. During anaphylaxis, lay the person flat, use an EpiPen, and call an ambulance without delay. 3. Asthma attacks lead to breathing difficulty and blue lips, requiring quick and calm action. Use an inhaler immediately during an asthma attack, and call for professional medical help. 4. Cardiac arrest involves sudden collapse and absence of pulse, demanding urgent life-saving steps. Perform CPR by calling help, checking vitals, giving rescue breaths, and positioning recovery posture. Quick, correct first aid can save lives in emergency situations like heat stroke or cardiac arrest. Why emergency response skills are essential for physical education instructors. Emergency response skills protect students and athletes during unexpected health or injury incidents. A well-developed emergency action plan, EAP, guides quick, organized reactions in critical situations. Practicing the EAP regularly ensures staff know their roles and respond confidently under pressure. Effective emergency handling minimizes injury severity and can save lives in school sports settings. Prepared instructors build trust with students, parents, and colleagues through demonstrated readiness. Stay prepared and prioritize safety in every physical education session.
The essential hands-only CPR steps everyone should know. Check if the person is breathing normally before starting CPR immediately. Call emergency services at 112 to get professional help on the way. Place the heel of your hands at the center of the chest firmly. Perform chest compressions at a rate of 100 to 120 per minute deeply. Push down about 2 inches deep on adults to ensure effective compressions. For children, use one hand and compress chest about 2 inches deep. For infants, use 2 fingers and compress chest about 1.5 inches deep. Keep compressing continuously until emergency help arrives at the scene. Hands-only CPR can save lives with quick and confident action in emergencies. The critical importance of CPR in sports for saving lives. Sudden cardiac arrest can happen anytime. CPR keeps blood flowing until help arrives. Every minute without CPR drastically lowers survival chances during cardiac emergencies. CPR works hand in hand with aids to restore normal heart rhythm effectively. Proper coach and staff CPR training ensures fast and effective emergency response. CPR knowledge is crucial for safety in youth sports and school activities. Sports organizations have a legal and ethical duty to protect participants with CPR readiness. CPR-trained personnel are essential at public sporting events for immediate emergency care. Immediate CPR can be the difference between life and death in sports emergencies. Promoting CPR awareness enhances overall safety culture in sports communities.
The 5 essential steps of the DRABC first aid approach. 1. D stands for danger. Always check for hazards before you approach the injured person. 2. R means response. Tap the person and ask clearly, "Are you okay?" to check responsiveness. 3. A is airway. Gently open the airway using head tilt, chin lift, or jaw thrust methods. 4. B represents breathing. Observe chest movement and listen for breath sounds up to 10 seconds. 5. C means circulation. Check for a pulse and start CPR immediately if there is none. Emergency management in physical education, ensuring safety and preparedness. Emergency management in physical education promotes safety and preparedness for all participants. Developing an emergency action plan, EAP, is critical to handle physical education emergencies effectively. CPR training equips educators with life-saving skills to respond during cardiac emergencies. Knowing the DRABC protocol helps assess and manage injured students quickly and efficiently. Regular drills and training sessions improve readiness for unexpected situations in physical education. Clear communication channels ensure quick response between staff and emergency services. Proper use of emergency equipment like AEDs can save lives during physical education incidents. Educators must stay calm and act confidently to protect students in crisis situations. Continuous evaluation of emergency procedures keeps safety measures up to date and effective.
Don't forget to like, share, and subscribe.
Top 5 Essential First Aid Purposes for Effective Emergency Management. 1. First aid aims to preserve life by providing immediate care to sustain vital functions. 2. It helps prevent the condition from worsening by stabilizing injuries and controlling bleeding. 3. Promoting recovery is key, supporting the body's healing process through timely intervention. 4. First aid provides temporary relief by alleviating pain and discomfort until help arrives. 5. Managing the situation involves maintaining calm and safety until professional medical help arrives.
Essential first aid steps for common emergencies everyone should know. Clean cuts and bruises with water, apply pressure using sterile gauze, then bandage securely. For heat exhaustion, move the person to shade and elevate their feet to improve blood flow. Use a cold sponge on the head and offer fluids to help cool down a heat-exhausted person. Check responsiveness and clear airway using head tilt if someone is having breathing difficulties. Observe breathing for 10 seconds to determine if further medical help is required immediately. Perform Heimlich maneuver by standing behind and giving quick upward thrusts above the navel. If unconscious during choking, clear mouth and begin CPR to restore breathing and circulation. Stop external bleeding by applying firm pressure and cover wound with a clean plaster. For small cuts, clean with sterile cloth, apply pressure, and consider stitching if necessary. The critical importance of CPR in sports for saving lives. Sudden cardiac arrest requires CPR to maintain blood circulation until emergency help arrives. Every minute without CPR drastically reduces the chances of survival in cardiac arrest cases. CPR works hand in hand with aids to help restore normal heart rhythm effectively. Training coaches and staff in CPR ensures quick and effective emergency response during sports. CPR is vital for the safety of youth in school and recreational sports environments. Sports institutions have a legal and ethical duty to ensure participants' safety through CPR readiness. Public sports events require CPR-trained staff to handle emergencies in large gatherings. Knowing CPR boosts confidence and preparedness among all sports participants and staff. Regular CPR training updates keep skills sharp and response times fast in sports settings.
Understanding sports injuries, sprains and strains explained clearly. A sprain is a stretch or tear of a ligament caused by sudden twisting or impact. Common causes of sprains include twisting motions, direct impacts, and sudden movements. Sprains frequently occur in the ankles, knees, and wrists due to their high mobility. Symptoms of sprains include pain, swelling, bruising, and limited joint motion. Initial treatment involves RICE, rest, ice, compression, and elevation to reduce symptoms. Immobilization with braces or splints helps protect the injured ligament during healing. Physical therapy is important for restoring strength and flexibility after a sprain. Severe sprains may require surgery to repair torn ligaments and restore function. Early and proper care of sprain speeds recovery and prevents long-term joint problems.
Understanding muscle strain, causes, symptoms, and effective treatments. A muscle strain occurs when muscle fibers or tendons stretch or tear due to injury. Common causes include overuse of muscles, forceful contractions, and inadequate warm-up routines. Symptoms of strain include pain, muscle spasms, swelling, weakness, and limited movement. Early treatment involves rest, ice, compression, and elevation to reduce pain and swelling. Gentle stretching helps restore flexibility and prevent stiffness after initial healing. Strengthening exercises rebuild muscle strength and support recovery from strain injuries. Avoiding activities that cause pain helps prevent worsening of the muscle strain. If pain persists or worsens, seek medical evaluation to rule out serious injury. Proper warm-up and gradual increase in activity intensity reduce the risk of future strains.
Effective RICE method for quick injury recovery and relief. Rest is essential. Avoid movement or weight on the injured area immediately after injury. Apply ice packs to the injury to reduce swelling and numb the pain quickly. Use compression bandages to control swelling and provide support to the injured area. Elevate the injured area above heart level to reduce swelling and improve healing. Start the RICE method right after injury and continue treatment for 24 to 72 hours. Take pain relievers like acetaminophen or ibuprofen if you experience discomfort or pain. Seek medical evaluation promptly if symptoms worsen or do not improve with RICE. After initial recovery, follow up with rehabilitation exercises to restore strength and mobility. Consistent care and attention speed up recovery and prevent further injury complications.
Top 5 preventive measures to avoid injuries effectively. 1. Start every exercise with a proper warm-up and stretching to prepare muscles and prevent strains. 2. Maintain strength and flexibility training to support joints and reduce risk of injury during activities. 3. Always use correct technique and form to avoid unnecessary stress on muscles and joints. 4. Choose supportive footwear that fits well to provide stability and reduce impact on your feet. 5. Incorporate rest and recovery days to allow your body to heal and prevent overuse injuries. Follow these tips daily to stay injury-free and enjoy your activities safely.
Essential first aid kit contents and maintenance tips you must know. Keep a torch with extra batteries for emergencies during power outages or low light. Include a blanket to provide warmth and prevent shock in injured persons. Carry an emergency CPR mask to safely perform resuscitation if needed. List important phone numbers like hospital, principal, and transport for quick access. Equip your kit with tools like tweezers, sharp scissors, and instant cold packs. Have a thermometer and 2 pairs of latex gloves for hygiene and temperature checks. Stock antiseptic wipes and solutions such as Dettol or Savlon to clean wounds. Include hydrocortisone cream, acetaminophen, and ibuprofen for common ailments. Basic supplies like sterile gauze pads, adhesive bandages, and elastic bandages are essential. Maintain your first aid kit regularly and keep a manual for guidance during emergencies.
Top 5 essential maintenance tips for your first aid kit. 1. Regularly check your first aid kit for expired or damaged items to ensure safety. 2. Replace any used or expired supplies immediately to keep your kit ready for emergencies. 3. Store your kit in a clearly marked, easily accessible location for quick emergency access. 4. Maintain a checklist to track inventory and avoid missing critical first aid items. 5. Educate your household or workplace on the kit's location and contents for preparedness.
Don't forget to like, share, and subscribe.
Effective safety inspection procedures to eliminate hazards in workplaces. Begin by collecting information on activities, equipment, and past incident reports for safety. Form an inspection team with safety experts and representatives from involved departments. Review all safety documentation for compliance with local, state, and federal standards. Check emergency equipment including fire extinguishers, first aid kits, and emergency exits. Examine workspaces for proper lighting, ventilation, ergonomics, and absence of clutter. Inspect equipment and machinery for condition, safety features, and maintenance records. Define the scope of inspection by identifying specific areas and hazards to assess. Conduct regular inspections proactively to prevent incidents from occurring in the workplace. Safety inspections protect everyone by identifying hazards and promoting a safer environment.
Essential roles and steps for first responders in emergency management. First responders provide immediate care and promote safety during emergencies to save lives. Always assess the situation first by ensuring your safety and identifying hazards around. Call emergency services promptly, giving clear details about location and nature of the incident. Perform primary assessment using the ABCD approach: airway, breathing, circulation, disability. Administer CPR and use an AED if trained and available to support basic life functions. Clear and open airways, providing rescue breaths as necessary to maintain breathing. Control bleeding by applying direct pressure, bandages, or tourniquets to prevent blood loss. Stabilize fractures with splints and immobilize injuries to reduce further harm. Ensure electrical safety by checking wiring and equipment for potential hazards before proceeding. Handle hazardous materials carefully, ensuring proper labeling and access to safety data sheets.
Top 5 crucial tips for primary assessment using the ABCD approach. 1. Check the airway first to ensure it's clear and open for the injured person's breathing. 2. Assess breathing by observing chest movement and listening for normal breath sounds. 3. Evaluate circulation by checking pulse and looking for severe bleeding that needs control. 4. Determine disability by quickly assessing consciousness and pupil response to light. 5. Prioritize these steps to provide effective immediate care and improve the injured person's outcome. Inclusive first aid training, key tips for equal access and participation. Inclusive first aid training welcomes all individuals regardless of background or ability. Use diverse, real-life scenarios to make training relatable and effective for everyone. Respect cultural beliefs and practices by using inclusive language throughout the training. Include instructors from varied backgrounds to represent and engage diverse learners. Provide accessible materials, interpreters, and extra time to accommodate all participants. Modify practical activities to suit different abilities, ensuring full participation. Offer training in multiple languages to break down language barriers effectively. Ensure fairness in access to care and training opportunities for everyone involved. Create a supportive environment that encourages questions and inclusive participation. Like,
Top 5 essential actions for basic first aid administration you must know. 1. Treat burns by cooling with water, wounds by cleaning and covering, fractures by immobilizing carefully. 2. Provide comfort by calming the injured and keeping them warm while monitoring their condition. 3. Communicate clearly with emergency services, giving exact location and injury details for fast help. 4. Coordinate with responders by sharing roles and updating each other to maximize aid efficiency. 5. Remember to stay calm, act quickly, and always prioritize safety for everyone involved.
top 5 essential first aid procedures everyone must know to save lives. 1. CPR is crucial for reviving someone whose heart has stopped beating effectively. 2. The Heimlich maneuver helps clear airway blockages to prevent choking emergencies. 3. Applying a tourniquet controls severe bleeding and prevents life-threatening blood loss. 4. Using an AED quickly restores normal heart rhythm during sudden cardiac arrest. 5. Treating burns promptly reduces pain and prevents infection for faster healing. Learn these life-saving skills to protect yourself and others every day.
Comprehensive emergency management, key steps and first aid essentials. Emergency response means ensuring safety and providing immediate care during hazards and risks. Common emergencies include heat stroke, asthma attacks, cardiac arrest, seizures, and severe bleeding. Initial assessment involves evaluating the situation, responsiveness, and vital signs quickly. Emergency action plan defines roles and protocols to follow during any emergency situation. Action includes administering first aid, CPR, or calling for professional emergency help immediately. Review the response effectiveness and update emergency plans regularly for better preparedness. First responders ensure scene safety, activate services, and perform ABCD primary assessments. Inclusive first aid practices involve culturally competent care and accommodations for disabilities. First aid kits must have essential supplies like bandages, gloves, medications, and a manual. Use the RICE method for injuries, rest, ice, compression, and elevation for quick recovery.
Understanding heat stroke, causes, symptoms, and emergency first aid steps. Heat stroke occurs when body temperature rises rapidly due to strenuous activities in hot conditions. It can damage vital organs and may be life-threatening if not treated promptly and properly. High fever of 104 degrees Fahrenheit or greater is a common symptom indicating severe heat stroke. Confusion, agitation, or slurred speech are signs that heat stroke is affecting the brain. Hot, dry skin or excessive sweating often accompanies heat stroke symptoms. Rapid breathing and pulse signal the body's distress during heat stroke. Fainting or loss of consciousness requires immediate action to prevent further harm. Immerse the individual in cool water or a shower to quickly reduce body temperature. Use cool, wet towels or ice packs on the neck, armpits, and groin to aid cooling. Fan and mist with water, then seek immediate medical attention without delay.
Understanding allergic reactions and anaphylaxis, emergency steps to save lives. Anaphylaxis is a severe allergic reaction causing breathing difficulties and swelling. This reaction may also lead to collapse, requiring immediate medical attention. Lay the person flat and avoid letting them stand to prevent worsening symptoms. Administer adrenaline promptly using an auto-injector like an EpiPen. Using an EpiPen correctly can be life-saving during anaphylaxis. Call an ambulance immediately to ensure professional medical help arrives fast. Monitor the person's breathing and be ready to perform CPR if necessary. Keep calm and reassure the person until emergency services arrive. Recognizing symptoms early and acting fast can save lives in anaphylaxis cases.
Understanding asthma attacks and emergency steps to take. An asthma attack can cause severe breathing difficulties and rapid worsening of symptoms. During an attack, symptoms may include blue lips indicating oxygen deprivation. Use a quick relief inhaler immediately to relax airway muscles and ease breathing. If symptoms persist or worsen, call for help without delay to ensure safety. Recognizing early signs can prevent severe complications and improve outcomes. Stay calm to avoid worsening the attack and help maintain steady breathing. Avoid triggers like smoke, allergens, and strong odors to reduce attack risks. Regularly monitor asthma symptoms and follow your doctor's action plan carefully. Ensure quick access to your inhaler and emergency contacts at all times.
Don't forget to like, share, and subscribe.